All right. Well, hello, everyone, and thank you for attending our COVID-19 Town Hall Unanswered Questions live stream. My name is Holly Foxworth. I'm a registered nurse here at Axiom Medical, and I'm also joined by our president and CEO, Mark Robinson, then also our chief medical officer, Dr. Scott Cherry. So, as most of you know, Axiom has actually been hosting a weekly COVID-19 webcast series on a variety of workplace-specific topics. And so, in Thursday's Pandemic Recovery, the Future of Business, we had several questions that came in that we weren't able to answer during the broadcast. So we wanted to bring those to you live stream today. So that's what we'll be covering. But before I start, I would like to just let our guests say hello and give us a brief introduction. Mark, would you like to start?
Sure. My name is Mark Robinson. I'm the CEO of Axiom Medical. Best job I've ever had, best team I've ever worked with, most amazing response that we've been able to put together to this crisis that we're all in together. I'm coming to you from my man cave in Deepest, Montana, where I'm writing this out. It's where my home is. So look forward to getting to the questions.
Great. And then Dr. Cherry, would you like to join as well?
Sure. Hi, my name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. I've spent the last 15 years supporting industrial, government, military, and corporate operations from a medical perspective. I've been with Axiom for the past 2 years, and it's been an absolute pleasure helping our clients through this pandemic.
Great. Well, thank you both for being able to join us today. I'll go ahead and jump right in. We did have a lot of questions that came in about temperatures and taking temperatures and documenting temperatures. So I'll start with you, Dr. Cherry. Give us some further thoughts around taking temperatures and then the process of actually documenting that, especially when you look at it from a HIPAA and protected health information standpoint.
Sure. So, obviously, taking temperatures proactively as employees are coming onto the work site is highly recommended. And so this question is kind of framed by that. And so, when you're screening for temperatures as your employees are coming on board, you really want to have kind of this threshold of what is normal or abnormal, and then refer them for more specific screening criteria, potentially with their own thermometer, engaging in an expert in healthcare. So regarding privacy, this is a personal medical piece of information, the actual temperature. And so I would recommend that the employer in general do not record the temperature unless it's a specific health resource that's doing that is partitioned off from the general kind of general operations of the company. And so if you don't have that ability to partition that information, I'd highly recommend utilizing a third-party health expert that would one, advise you what to do with that elevated temperature, but two, also record that information for future use if needed. Mark, did you have anything to add?
Yeah, look, the reason it's desirable to have access to a record of the actual temperatures is in the context of potential future litigation. If the employee were to bring the claim that they had acquired the virus at work, defense that you actually did a great job of monitoring temperatures and identifying symptoms, number one. And number two, that on specific given dates, their temperature was in a specific range, and so was everybody else in the company, and therefore there was no prospect for exposure at work.
Great. Well, the next question actually came to us from a viewer. Dr. Cherry, I'll ask you again. They had referenced the Journal of American Medical Association. They had talked about fever, about mentioning a high fever is maybe not a direct indicator for COVID-19 testing. Do you feel like they maybe have been explaining more that you have to take a broader look at the full angle of what's going on with the patient that's presenting, or what's your take on that?
Yes, exactly. Fever, cough, shortness of breath was really the primary symptoms the CDC was recommending to assess for symptoms consistent with COVID-19. Internally, we've been utilizing a much broader approach with all the symptoms that were identified in the World Health Organization's report from Wuhan, China, about 5 weeks ago. I believe recently they've just added several more symptoms to the CDC guidance. What's interesting is that this type of disease has all kinds of presentations. And so although it's primarily a respiratory disease, we're seeing different types of presentations where they may have nausea, vomiting, diarrhea as kind of their first indicator of disease. And so one of the most recent articles or studies that came out was that fever was a relatively low indication of infection, about 33%, at least early on in the disease. And so I agree that, you need to have a strong indication of testing aside from just having fever early on. And so you really don't want to have anyone with any type of sick or ill symptoms coming onto the workplace.
Great.
Any comments, Mark?
Yeah, look, like many things, it's not simple, it's not straightforward, it's complex. It's one of the reasons to engage in with medical support to help you make those complex decisions, which you may not be able to make well from within your own expertise.
Great. And then speaking about some pre-screenings, we discussed that in the webinar this last week. We had one that had asked about having employees self-monitor, so basically taking their own temperature and reporting if they have symptoms. Do you feel like that this is an effective strategy, and how would you maybe go about implementing something like this?
Yeah, so I feel strongly that monitoring for self-monitoring for symptoms is a great practice. With temperatures, I think the best practice is the employer actually taking the temperature, but if there's limitations with that, then self-monitoring is also a great practice to employ. Let's see the second part there. What are your thoughts on that? Yeah, so again, I think self-monitoring is definitely a huge component of this. And if you can have some type of system that really employs kind of a practical approach that everyone is doing it consistently, and you have some type of way of having a documentation of compliance is absolutely critical. Any thoughts, Mark?
Yeah, it's definitely. So look, you could make a strong argument that you don't want somebody to show up to your work site at all if they have or suspect they have this disease or any other infectious disease come to that. So having people pre-screen themselves before they come into work and then default into a formal screening protocol is a really good idea if you can manage that effectively. I've had people ask questions about, well, what if the employee misleads or lies because they don't want to potentially lose income during a period away from work if they're hourly paid, for example? And the answer there is, we're living in a whole different world right now to the world we lived in just a few months ago. And I think all of us have to take a careful look at our absence policies and craft policies that are designed to encourage employees to be honest in terms of self-disclosure rather than penalizing them financially for that honesty.
Great. And the next thing that had came up was the issue of social distancing. I think that everybody is finding that as we're talking about reopening the economy and returning to business, that subject is top of mind on how it is that they're going to be able to manage some of these challenges that are there. So, Mark, you had brought it up, I think initially, and I'm sure you as well, following that, but just the topic of lunch breaks and break periods in general. How do you address that whenever we're calling for closing some of these general gathering places?
Look, go ahead, Scott. You go first.
Mark, I was going to actually ask you to take that one, please.
Okay. So look, when you're in a position where you're in a conflict between two laws, my personal approach is to look which one costs and hurts the most if I break it, because I've got no choice but to break one or the other. However, in this particular case, that may not be strictly true. you may just want to manage the flow of people into and out of these common areas, a case of kind of one in, one out. If it's a large space and distancing can be observed within the space, then perhaps it's safe to allow one or two people in. If you provide cleaning supplies and you make sure that areas that are touched by individuals are properly sterilized and cleaned between uses, it may well be okay. So you can be in compliance with the regulations that require you to provide and accommodate a common area, and at the same time you can avoid the risk of communicating an infectious disease through close proximity.
Great. The other one was related to some of the respiratory protection barriers that are there. I mean, do you feel like that when people have to work within that 6 foot space, do you feel like that having a physical barrier there is sufficient, that's enough? And also the subject of how are people able to get masks when you're seeing that there's restricted sales on some of these N95s that are specific to medical professionals? Do you have anything you want to add there, Dr. Cherry? I know you've done a lot of on-site visits.
Sure. Kind of one of the traditional or core tenets of industrial hygiene is to look at the risk and try to mitigate it through several different hierarchies of approach. And so obviously, if you can substitute out that exposure or kind of a workplace function, that's usually the best. But then you can go into administrative actions that may limit exposure or personal protective equipment, things like that. With this, the way the CDC has issued guidance for especially critical infrastructure workers is that they recommend to stay 6 feet away, but they also recognize that that may not be possible for all types of work that needs to be done out there. And so I think if you can utilize engineering controls such as barriers, that adds to the protective status, in addition to also having, masks or face coverings as well. And so, I think a physical barrier is definitely something that should be considered when work is within 6 feet of one another. Looking at N95s restricted to medical professionals. So again, I think employing face coverings is really important at this time, especially when you're going to be working, if workers are going to be within 6 feet of one another. And I think the commercial supply may be improving at this point. However, the CDC has empowered employers to empower their employees to make their own and to allow that to be brought into the workforce until sufficient supplies can be provided by the employer.
Just a couple of points. Masks serve two potential functions. One is to prevent somebody who has the disease from passing it on to other people. And the other function is to prevent one person from getting that disease from another person. A cloth mask does help prevent passing it on to other people because it's a barrier for the fomites, the little moist particles with virus on them. It's a barrier that reduces the spread of fomites. And two people wearing cloth masks working in fairly close proximity have at least some better chance of not getting the virus than they would if they were unmasked. N95s can be very uncomfortable to wear for extended periods, for long shifts, and they can result in bruising and other kind of damage to the wearer over time. Your best option is always to try to create a workspace where people can maintain that 6 foot or greater distance. Even if that involves reducing the density of employees in the workspace and keeping more employees at home. I would personally only consider allowing somebody to work in closer than 6 foot proximity if it was essential to the nature of the task and the task itself was essential.
Well, that takes us right along to the next question, which asks specifically about elevators. And I've seen that there's also been questions that have came in this last week about airplanes as well. Mark, do you want to tackle that on how the issue of elevator use should be limited?
Yeah, sure. Not all elevators are created equal. Some are larger than others. Some can accommodate 20 people. Some can only accommodate 3 or 4. Regardless, I'd say that your average elevator ride is significantly shorter than 10 minutes. And the guidelines from the CDC are within 6 feet of proximity for 10 minutes or greater. So the risk from an elevator should be quite low, except for the potential risk from touching elevator buttons or other surfaces within the elevator. If you have a small elevator and a lot of demand, then I would suggest just very carefully informing people of the risk of extended proximity, and also having somebody do very regular cleanings, and also reminding people that if they do touch surfaces away from their own desk, that they should actually use a hand sanitizer or wash their hands having done so. One final thought, it's a lot healthier to walk up the stairs than it is to take the elevator anyway, and perhaps this is an opportunity for people to get a little bit healthier and do a little bit more stair climbing.
That's a great point. Well, speaking of masks, and Dr. Cherry, I'll ask this one of you. We've seen that the CDC guidelines has published about facial coverings when you're going out into public, but some of the business owners that have contacted us have said, "Hey, we're not a public business. We're a private property." So, does the CDC guidance does that actually apply to us?
Yeah, that's a great question, and I remember my comments last week on this specifically, where I was stating that the CDC guidance for the general public is to wear face masks while they're out. And so I extended that into the workplace. So this is a great question. And I'm not a lawyer, so I can't say if it meets the legal definition, but I can definitely appreciate the gist of this question. And so it probably does not meet the general public legal definition. And so let's see, the second part of the question would be, are not public environments, so are they really required? So I would say no, they're not required. And so obviously you want to try to be as protective as possible during this pandemic. However, if there's a business decision or reason why they're not, you can't allow your employees to wear face masks, that is something that needs to be an internal business decision. I've been strongly advocating for that as broadly as possible. CDC guidance has issued when you can require a mask when employees are returning to work, especially when they've been recently exposed to a confirmed or presumptive positive case. And so, but I may actually rely on Mark here on his leadership on just in general requiring it for a workplace.
Look, you're not required to, clearly, except in the narrow circumstances that Scott indicated, where you have somebody who has been exposed and they've been exposed. However, what kind of employer are you if you don't do everything you can to protect your workforce? What kind of employee is going to decline to wear a face covering? And we're not talking about N95 masks or respirators. We're mostly talking about simple cloth masks. What kind of employee is going to decline to wear one of those in the workplace? On what basis are they going to decline? You really need to be addressing this, I think, as a cultural issue. It's how you as an employer care for your workforce, or how you as a leader care for your team members, number one. And number two, encouraging that climate of inclusivity where everybody on your team cares equally about all of their teammates. And so as a gesture of respect towards everybody, I'd expect workers to be very willing to wear a mask in the workplace, even if not required by law or by the nature of their task.
Great. The next one actually leads right into that, and it was asking about, can you require employees to provide their own mask? I know there's been an issue of supply and some of the things that have gone along with that. So do either of you have any thoughts about requiring them to provide their own mask?
Your thoughts, Mark?
Yeah, I think you can only require them to provide their own mask if you compensate them for the cost of acquiring or making that mask. Otherwise, I think it's on you. What you can do, though, is say that I won't let you into the workplace unless you have a mask. I think it's a trivial expense to be able to supply or to compensate employees for it. Most employees, however, I think will be perfectly willing to wear a cloth mask as a condition of access to the workplace, regardless of who pays.
And then our final question actually kind of relates to the overall strategy of addressing the pandemic while managing fear and distraction in the workplace. The viewer had mentioned that WebMD was saying only a small percentage of the population had been infected. And so their question was, how much do we need to change our way of operating to accommodate such a small percent? And is there such thing as a more targeted changes to our operations versus just a blanketed approach?
Yeah, that's a great question. And I think what I'll speak to quickly is just the the comment about the small percentage of the population that has been infected. And so what I would actually say is a small percentage of the population has been tested. And so there's a small percentage of those being tested that are infected. Some studies that are now doing random sampling of the population, so population that isn't necessarily sick or in the hospital, but just out in the community, to try to get a better understanding of what we call prevalence, which is kind of a baseline level of disease into a community. And there's been estimates that the number of actual infections are probably 50 to 100 times higher than what would be what we're tracking from a testing perspective. So just, but I think the question still has merit, and I'd like to pursue that. And so there are clear categories of higher risk for severe disease from COVID-19. And so based on that second part of the question about are there alternate strategies to help risk mitigate, instead of having this blanket approach is how they call it. So really you want to address the CDC's high risk groups, which right now are age greater than 65, those with chronic medical conditions such as chronic respiratory and chronic cardiovascular disease. Recently, they've added obesity defined as a BMI greater than 40. And so those are high risk groups that should have special consideration in the workforce. And so obviously those categories are also what we consider protected classes under the Americans with Disability Act. So you want to approach this very carefully with your HR and legal consultation and really look at putting out messages to your workforce to say, speak with your doctor. If you meet some of this criteria, please provide medical documentation to engage in what we call the reasonable accommodation process through the Americans with Disability Act. Any thoughts from you, Mark?
Yeah, look, I read those sampling-based studies as well, and there's a couple of comments on that. First of all, I think we can be fairly sure that on average across America, 20% or less of the population have had COVID-19 to this point. That's well below the level by which acquired immunity, even if there is acquired immunity, which we don't know for sure yet, would operate to reduce the frequency and level of spread of the disease itself. So, essentially what we did through all of the voluntary and involuntary work from home, social isolation stuff, what we did is slow down the curve of the rate at which this disease was accelerating through the population. However, when you look at the math and when you look at the other epidemiological studies that have looked at diseases that have come and gone in the past, what you see is that ultimately this probably doesn't actually reduce the number of people in total who will actually get the disease. Only herd immunity, acquired immunity, reducing the frequency of spread, which from what I understand needs to be somewhere above 70% of the population exposed, or a successful and widely adopted vaccine will actually reduce the risk of spread to a lower level. So I feel this is something we're going to be living with for quite some time. Dr. Cherry's point about protected groups, about vulnerable groups, I think it's incumbent on all of us as employers to do what we can to protect those people who are more at risk than the average in the population. And so when we talk about blanket changes, I would always look to make thoughtful changes designed to protect the most vulnerable. And one of those changes might be allowing, enabling, and encouraging those vulnerable people to continue to work from home, even after there's a wider return to work from the office.
Great. Well, before we close today, do you guys, either one of you, want to have any closing remarks? Any final parting statements? I'll start with you, Dr. Cherry.
Sure. There's still so much unknown about this disease and everything about it. I think because of our technological advancements from previous years and decades of pandemics in the past, obviously a lot of information is at the forefront, but there's also potentially a lot of misinformation or just anecdotal information. And so one thing that can help potentially with some of that is to take a breath when you see new information and make sure it's coming from a valid source, potentially a university or governing body, versus potentially articles by media or less reputable or valid sources, because that will help a lot, because that's something I'm seeing a lot with our clients or even friends and family. And so I always try to be aware of what's happening in the media, but also trying to verify that with what I'm seeing from our reputable institutions of higher learning or of authority.
Amen. Look, news, I try and limit myself to 10 minutes a day of kind of general category news, and everything else I pursue from trusted sources. And I think that's definitely the way to go here. If you haven't identified who can be trusted to give you good advice, put some effort in, figure it out, and engage with those sources of advice. This is going to be with us for some time. This is a feature of our workplace landscape, at least in my personal opinion, at least through the balance of this year into next year. It's highly unlikely, again, in my personal opinion, it's highly unlikely that we go back to an environment quickly where there are no new cases and no new fatalities. And I think, therefore, it's incumbent on all of us to do what we can to help manage and reduce the speed at which infection spreads and the degree to which the vulnerable in our communities are exposed. And as leaders, as business leaders, that's on us, both at work and at home and out in our broader community, because most of us who lead in business are also leaders outside of the work environment, and people look to us for an example, and we should be the best example we can.
Great. Well, thank you both for joining us today. I mean, it's been a pleasure having you here. Again, just a reminder that we do have another webcast that's coming up this Thursday at 1 o'clock. You don't want to miss that. It's Dr. Cherry. He's going to be discussing pandemic adaptations safely back to work. So again, that's Thursday at 1 o'clock p.m. Central. If you haven't already, be sure to register, and we'll see you then. Thank you again. Bye-bye.
Goodbye, everybody.